Hi, my name is Elaine Meehan and I'm a postdoctoral research fellow at the Murdoch Children's Research Institute in Melbourne, Australia. Our paper in the May 2017 issue of DMCN reports on a study of emergency service use in children with cerebral palsy. So we know that children with cerebral palsy have more complex care needs than children in the general population, but we don't know much about their patterns of emergency service use. We also know that by studying the patterns of emergency service use in groups can give us an insight into the appropriateness of emergency service use in a region, as well as the accessibility of primary care. Studying patterns of service use in typically developing populations, however, is not always generalizable to children with disabilities for many reasons. One being that children with disabilities often have requirements for emergency department care for conditions and other acute events, which may be managed appropriately in primary care for children without disabilities. So to begin to explore this issue and to investigate emergency service use in a large cohort of children with cerebral palsy, we linked a state cerebral palsy register, so the Victorian Cerebral Palsy Register, to our state's emergency department data set, the Victorian Emergency Minimum data set. So what did we find? Well, children with cerebral palsy who are aged 5 to 19 years accounted for approximately 1% of emergency department presentations in their age group. Children that were functioning at higher GMFCS levels had more emergency department presentations. And when we looked across the entire group, we found that children who were functioning at GMFCS levels 1 or 2 had similar numbers of ED visits to children from the general population, whereas children that were functioning at higher GMFCS levels, so levels 4 and 5, had substantially more ED visits each year compared to other children. Respiratory illnesses were the most common reason for emergency department visits in the cerebral palsy group, while injuries and poisonings were among the most common reasons in children without cerebral palsy. Compared to other children in the ED, children with cerebral palsy were more likely to arrive by ambulance. They were more likely to have their visits triaged as high urgency, and they were more likely to go on to require an overnight hospital admission following their presentation. But what does all this mean? So, despite the fact that children with cerebral palsy accounted for less than 1% of ED visits in their age group, there was a marked difference in the use of healthcare resources between children with and without CP. So specifically, children with CP were more likely to require an ambulance arrival, to have their presentation triaged as urgent, and to go on to require an overnight admission. Children that were functioning at the higher GMFCS levels, so GMFCS levels 4 and 5, differed most from the general population for each of these factors. So it may be that this reflects the severity of their presenting complaints, but it may also be due to their underlying diagnoses and to other non-medical factors. So specifically, it may be due to a perception of greater severity due to non-ambulant or non-verbal status. If emergency services are being overused in this group, then strategies to address this are warranted, because in addition to having negative implications financially for health services, unnecessary ambulance trips, ED visits and overnight hospital admissions are unpleasant for children and their families also. Given the differences that we found between cerebral palsy and non-cerebral palsy ED visits, any strategies to address unnecessary emergency service use in children with cerebral palsy need to be targeted specifically to this group. We go into this in much more detail in the paper, so I hope that you enjoy reading it. Thank you for listening.